Since starting physiotherapy training, I have discovered that at least 6 things I believed about exercise for my entire life are not just slightly inaccurate. They are demonstrably, scientifically wrong. And the frustrating part is that these incorrect beliefs are repeated constantly by fitness influencers, gym trainers, well-meaning friends, and even some healthcare professionals who trained before the current evidence base was established. Getting these wrong is not just ineffective. Some of these myths are actively causing injuries in millions of people. Let me correct them one by one with what the research actually shows.
Myth 1. No pain, no gain. This is one of the most harmful ideas in fitness culture. There is a critical distinction between the discomfort of muscle fatigue during intense exercise, which is normal, and the sharp, joint-specific or referred pain that signals tissue damage or nerve irritation. Exercising through the second type trains the nervous system to associate movement with threat, which is a primary mechanism contributing to chronic pain development. Train hard. Do not train through pain. Myth 2. Static stretching before exercise prevents injury. The research is consistent and counterintuitive. Static stretching immediately before exercise temporarily reduces muscle power output by up to 8% and reaction time for 15 to 30 minutes. The correct pre-exercise preparation is dynamic warm-up, progressive movement that increases tissue temperature and activates the neuromuscular system. Static stretching belongs after exercise. Myth 3. Sit-ups and crunches strengthen your core. The rectus abdominis, the surface muscle trained by sit-ups, is a spinal flexor. Stuart McGill's 3 decades of research has shown that repetitive spinal flexion under load is a primary mechanism of intervertebral disc herniation. The deep core stabilizers, the multifidus, transversus abdominis, and pelvic floor, are best trained through anti-movement exercises. Dead bugs, bird dogs, and planks resist movement rather than create it.
Myth 4. More exercise is always better. Recovery is when adaptation occurs. During exercise, you create controlled tissue stress. During sleep, growth hormone and anabolic proteins repair and strengthen that tissue. Athletes who train without adequate recovery do not get stronger. They get progressively weaker and injury-prone. The optimal training stimulus is the maximum load from which you can fully recover before the next session. Myth 5. Cardio is bad for your knees. The evidence consistently shows that people who run regularly have lower rates of knee osteoarthritis than sedentary people. Cartilage receives its nutrition from the synovial fluid produced by joint movement. Movement, including running, maintains cartilage health. The problem is not running. The problem is running with poor mechanics, inadequate strength, or inappropriate load progression. Myth 6. You should feel sore after every workout. Delayed onset muscle soreness occurs when muscle fibers experience microdamage during eccentric loading. As training adaptation occurs, the same stimulus produces less soreness because the muscle has adapted. Absence of soreness does not mean absence of training stimulus. Experienced athletes train intensely with minimal soreness. This is progress.
Getting these 6 things right will not just improve your fitness outcomes, it will significantly reduce your injury risk over years of training. Understanding the science behind why these myths persist and what the evidence actually shows is exactly the kind of knowledge I am gaining in physiotherapy training. Subscribe to PhysioWise for more evidence-based corrections every week. Comment below which of these 6 myths surprised you most.